petechiations, and then you can possibly have hemorrhage of the intestines and mesenteric lymph nodes. And again, what we showed you guys earlier is these diamond-shaped lesions that you guys see here and over here, and that's like almost pathognomonic. So for the acute form, the skin lesions may, as far as lesions and necropsies, the skin lesions may be absent, but if present, what we showed earlier, you'll see the actual diamond skin. And there can be large hemorrhages throughout the body, are often also reported, and again, what I showed you guys earlier is petechiation of the kidney capsule. So for the chronic form, you can have non-suppurative proliferation of arthritis involving the limb and vertebral joints, as you guys see here. And you have ankylosis, which is basically like the stiffness of the joint, and then you have thickening of the joint capsule. And again, this could be due to, again, this is associated with the vasculitis. And fibrin, exudate fibrin can also be deposited in these areas as well. So the microscopic findings, I'm going to show you, let me orient you, this is the skin, so we're going to actually look at this is the dermis portion, this is the epidermis, and this is keratinization, and this is a hair follicle. So here I'm just going to show you guys thrombosis, as you see the area pointing to these darker shaped blood, and then here's some hemorrhage, the loose forms that you guys see here, and this is just to give you an idea of what exactly is going on. So you have some thrombosis that occurs with this disease as well as hemorrhage. And over here, this is a artery, so you kind of see, again, you can see some hemorrhage and some thrombosis, and like the thrombosis is the darker stain, and edema is also present right here, these little spaces, but it's not that very prominent, but you guys can note it here and here. And then these little white spots is just fat. So diagnosis is based on clinical signs, the gross lesions, and response to antimicrobial therapy. So positive culture of valvular vegetation, and that's also can be seen in the chronic form as well as endocarditis. So when vasculitis occurs, exudative fibrin can be deposited, and then they'll form these little, almost cauliflower-like clusters on the valve, and this normally affects the mitral valve in pigs, and then it can lead to sudden death. And this valvular vegetation can occur without any other clinical signs. And another way to diagnose this is bacterial culture of all the affected organs, and if not bacterial culture, you'll do PCR. So treatment, the main choice for treatment for this disease is penicillin, and you can also use corticosteroids, but tetracycline can be used, but it's not as effective. Your main to-go treatment for this disease is penicillin. So how do you control this disease? Well, eradication is impossible because, as she stated earlier, that if the disease is, the bacteria is naturally present, especially on endemic farms. So what you want to do, what you'll tell farm owners is to do good husbandry, and if there is an outbreak, you want to vaccinate during the outbreak. You don't wait till the outbreak is over, then vaccinate. You want to vaccinate while the outbreak is occurring. And this would kind of help reduce the clinical signs. So as I stated earlier, vaccination can be very effective. If you cease vaccination, you can lead to a disease outbreak. So if you see farmers that possibly have, or if you see a question on the NAVLE that's associated with this, like what is your most likely option, which you'll tell the farm owners, you'll be like, let's vaccinate during this outbreak. And then let's treat the affected, and if you can't treat them, then you'll remove them from the herd. And then you'll vaccinate and make sure you have good husbandry to try to reduce any other outbreaks. These are our references. Any questions? During the outbreak. You can vaccinate before, but I had read one source, they said also if you have an outbreak, you vaccinate during the outbreak as well.
So normally you vaccinate just once, and it should be it should work if you just vaccinate just one time for life. That's what I read on the resources.
So no boosters, just once and never again? Any additional information? It looks like you want to give us some more information.
Well, you can vaccinate twice a year. Some sources say do vaccinate twice a year, especially if it's in an endemic area. You'll do the initial vaccine and it'll help clear up the signs in 2 to 3 days. And but if the signs haven't cleared, then call those animals, but vaccinate twice a year. But also you can do once a year. But it just really depends on the source that you read.
And it also depends if you're treating the animal. If you are just expecting the vaccine to work without using penicillin in this case, so more likely will be better vaccinate and treat with a adequate antibiotic, which in this case will be penicillin.
Yeah. Any other questions?
So second year. Dr. Graham, I'm sure circulatory disturbances because you got a lot of strong line, formation, and that kind of thing. What those criteria that go into the formation of a thrombus? Okay, what are those criteria that you're likely to see? 1 or 3 different criteria that goes into the formation of a thrombus? It's a vascular thrombus formation within blood vessels. Yeah, right, but I'm just saying, what contributes to a thrombus being formed in the first place?
Hypercoagulation? Hypercoagulation?
What the morphology is going to lead to thrombosis? What causes blood to form a clot? What causes the clot to form in the blood vessel? That's moment for okay, right. Endothelial damage? What else? Turbulent blood flow? Right. What's the third? Okay, what is it? Like a hypercoagulable state. Hypercoagulable state.
So we have questions for you guys. Which age group is normally affected?
Ready? So number 2. What is the treatment of choice for spinal Arteritis? Ready for the next one? So which one of these are pathognomonic lesions for spinal Arteritis? Everyone good?
Yes.
Okay, thank you.
What's the first question? Which is it post-wean? Is it finished? I don't know.
Good morning.
So my name is Angelica Reed Jemerson, and
I'm Alex Edwards.
we'll be talking about verminous arteritis in the equine. So, verminous arteritis is caused by a large strongyle called Strongylus vulgaris, and it's really big. It's up to 25 millimeters. Other types are Strongylus edinatus and Strongylus equinus, but those are basically concerned with the liver and the perirenal tissues, as well as the retroperitoneal tissues and pancreas. They're known, or they're called bloodworms or redworms because of their appearance and how they look. They're red. But this is an egg of a strongyle, and this is how they look. So this is like kind of like an overview of their life cycle. So the first and second stage are associated with the free living stage, which can be found in the soil or the feces. And this is not the infective stage. But when you get to stage 3, that's when it becomes the parasitic stage. But this can also be in the vegetation and water films. And then when it gets to the 4th stage, that's the stage we worry about, because that's the stage that causes the inflammation in the craniomesenteric artery because of the migration from the large intestines to the artery. And then it basically stays there, and 6 months later, it's an adult, where it attaches to the mucous membrane and goes back to the large intestine in the cecum and large colon, and eggs are passed in the fecal material, and then it starts all over again. So this is an important parasite because it can be very dangerous. Adult large strongyles, they have large mouth parts or buccal capsules, and they are active blood feeders. They ingest mucosal plugs as they move about in the intestine, and they can cause damage to the craniomesenteric artery. And if you guys remember, that is the artery that supplies the gut. So you guys know that horses pretty much can die of anything. So anything that disturbs their gut blood supply can be bad. Like I said, it causes a verminous arteritis, and you'll mainly see it in the craniomesenteric artery, but because you can have some aberrant migrants, you can see them in the aorta. They can cause a widespread vasculitis and inflammation. And clinical signs include diarrhea, lethargy, anemia, weakness, emaciation, thromboembolic colic, gangrenous enteritis, intestinal stasis, torsion and interception, and possible rupture.
Okay, so diagnosing. The biggest thing is going to be the clinical signs. However, a lot of the clinical signs aren't very specific. So you can also see things such as the eggs will be found in the feces. But in order to make a differential diagnosis or an actual diagnosis, the best way to do it would be post-mortemly. So on necropsy, you'll see walls of the craniomesenteric artery will be thickened and will often contain the S. vulgaris larvae. You also see infarction and necrosis intestine due to the thrombi and the emboli. So you can also palpate rectally, and when you palpate rectally, you can go in and you can feel the aorta. Your aorta is going to be very firm. You're going to feel it pulsating as well, along with the heartbeat. You can also use ultrasonography rectally to see the blood flow, and then arteriogram is more of a kind of complicated method. It's kind of an X-ray, but for arteries and vessels. So you can use that to also see the blood flow and see where the pathogens is coming from. Moving on to gross lesions, right here you can see the worms feeding onto the large intestine here. And then here, these actually aren't worms, but they're what's called fibrin tracts, and these are the signs that worms will leave, and you can see where they've been migrating from, and this is the aorta here.
All right, so like I said, you guys know they pass from the large intestine to the craniomesenteric, back to the large intestine. So sometimes they'll form these nodules while they're passing, and the immature adults will kind of emerge from the nodules and cause disappearance to the intestines. And over here you can see the thrombosis in the craniomesenteric artery. You can see this ballooning effect as well, but that's due to all the accumulation of fibrin and degradation of the vessel.
So here we have hemomalassomoma ilii. And so what this is here, as you can see, these nodules here are from the migrating strongylus, and they're actually going to cause raised submucosa, lesions along the ilii from when they burrow into the intestine.
And we were able to, this isn't an exact strongylos vulgaris, but this is like how it would look on a cut arterial surface. And this is like the musculature of the worm, these arrows. This is the actual wall of the intestine, or lumen. And that's as deep as we're gonna get into that. But this is how it would look on histopath.
Okay, so differential diagnosis. Like we already said with the clinical signs, most of those aren't really specific. So for differential diagnosis, you get anything that causes colitis or colic. You can also see other parasitic infestations such as Piscaris ecorum. So that's mostly found in foals, and that's also going to be what's different than Pastrangulus, but it's going to be a roundworm, and it's going to be found mostly in the GI system. You can also get a false aneurysm, which is different than a true aneurysm because the ballooning effect is not due to the thinning of the adventitia, but instead there can be maybe a lesion in the intima and then causes the arteries actually look ballooning, but the wall actually isn't thinning. So that would be considered a false aneurysm. They look the same in terms of cross-section. You can also see plant toxicity, so cocklebur and pigweed. Those are two of the most common plant toxicity found in horses. Both of them can cause colic, weakness, diarrhea as well. Basic treatment. So parasite control, obviously Pastrangulus vulgaris. In terms of doing the larval stages, you're using ivermectin and amoxicillin. The adult parasites, you're going to need more of your stronger antihelmintic, so fenbendazole or oxybenzole. In terms of daily administration, pyrantel tyrate prevents the establishment of the arterial stage, and you can also use ivermectin on a day-to-day basis as a daily preventative. So just a summary of the disease. So by definition, aneurysm is a vascular dilation caused by the weakening of the tunica of the blood vessels. So you'll see that from the actual thrombi forming in the emboli. Those will cause the weakening. It's not technically the thinning of the vessels, but it will cause the weakening. You'll see the ballooning happening in the vessels. Disruption of the endothelium is what actually causes a thrombus. Like we said, the most likely cause Pastrangulus vulgaris will lead to severe colic, constipation, diarrhea, and the best way to prevent this controlling is to treat with antihelmintics against Pastrangulus vulgaris.
All of this has previously been said, but just to summarize, again, like I said, the cranial mesenteric artery is the main artery associated with the Pastrangulus vulgaris. So, like I said, as you can see, it branches off, like to form different arteries to other parts of the gut. So it's, it's very important, like, to control this parasite because it can get bad. The inflammatory mediators, like Alex said, can cause local damage to the vascular, resulting in colic, diarrhea, and lethargy. And I already said before, they can migrate to and from the large intestine and the cranial mesenteric artery, and can cause stasis of the gut blood supply. And there have been severe cases that can result in death as well. So these are our references. And you have any questions? Yes.
Just out of curiosity, the treatment options that you guys listed, are all of those, are any of those off-label?
I don't know. She said, are any of the treatments off-label that we chose to use? No. Dr. Gilbert? Oh.
So how come, because I thought you can't use an ivermectin really, because it's not really for gastrointestinal, so what else?
Isn't that only cats and dogs?
Okay.
You're fine. Dr. Gilbert?
Can you tell them a common sequela to cranial mesenteric artery aneurysms and thrombosis?
Like a thromboemboli?
Yeah,
Or are you looking for something else?
yeah, but where does it occur? It's like a classic sequela in horses that have this disease. I know where it is. Like if it goes in the aorta, where it's going to be stuck, like in cats. So.
Oh, yeah, I was gonna say the saddle thrombus. Okay. Any other questions?
Second year. Thomas was speaking, doesn't feel like that last year, right? Well, if you're doing a necropsy on a horse, you want to identify the cranial artery. Where are you going to look? What's going to help you? The landmark there. At what level on the order will you look? So you've been fighting this horse, you got on the necropsy table, right? And you want to find and check the cranial artery. We you suspect, let's say, what they discussed. What's your landmark? What would you use to locate that cranial artery in this horn? Absolutely. So the adrenal gland is a good landmark, right? So if you remove that adrenal gland and kind of course it right underneath that adrenal gland and the level of the first lumbar vertebrae. That's what you want to do it.
Thank you guys. And we actually have a few questions for you guys. Oh, then here's Shader on the mic.
They're not alone. Which species of strong eye will cause Vermenous arteritis? A, B, or C?
Let us know when you guys are ready.
Cool. We can go to the next one. Which stage of larva causes inflammation?
It's supposed to be
A, B, or C?
sorry. It's supposed to be of larva. Which
Not
stage?
or of. Yeah, sorry.
Which larval stage?
Mm-hmm. Yeah.
Just rephrase it. Which larval stage?
Which larval stage?
Everyone good?